Good evening. Hello and welcome to this edition of the India Development Debate. I'm Nayantara Rai, working from home. The good news is that India continues to see a significant decline in coronavirus cases. 20,000 infections have been reported over the last 24 hours and 279 deaths. That's much lower. With this, the total COVID count in the country is at about 1.02 crore, with close to 1,48,000 deaths. COVID recovery is improving. It is now at 95.83%. Meanwhile, as COVID vaccine trial enters the last lap, what we have started seeing are dry runs, trials being held by the states when it comes to their preparedness. And we have a very special guest today on the India Development Debate. He is the Principal Scientific Advisor to the Narendra Modi government. Joining us live is Dr. Vijayraghavan. Dr. Vijayraghavan, thank you so much for taking the time out. I did interview you about a fortnight ago, sir, on this very show, when you told me that we could have good news our way by the end of 2020 on the vaccine front. So we're still awaiting the authorization for those applications before the task force as far as the vaccine goes. What's the latest update, sir?
Well, you must keep in mind what the Prime Minister said, that we must all be patient and follow our rules and regulations and allow scientists and regulators to take a call. That's exactly what's happening. People have been very patient and very careful, and our regulator is examining submissions from vaccine companies on a variety of vaccines. The expectation is that we will have good news early next year. That's in a few days from now.
So we will have good news. Early next year. I know it's just about a matter of technicality, but a day or two here. Would that also therefore mean that as far as AstraZeneca serum vaccine goes, or Pfizer goes, or Bharat Biotech goes, so no chance of an authorization before 1st of January 2021? Is the task force not meeting?
No, I wouldn't put a date so firmly about whether it is late in December or early in January. The drug controller has a set of committees which looks into data. They have standard regulations by which they evaluate and see whether vaccine candidates meet the bar or not. So it could come very soon.
Sir, all of the vaccine applications that are before the regulator, before the task force, are different. Whether, you have some which might need one dose, some might need two doses, plus the storage temperatures are of course very, very different. For example, we know the case for Pfizer and the AstraZeneca serum vaccine will be very different for the temperature control. So how are the preparations going? And in light of the fact that dry runs have also started in states?
Yes, these are all very, very important. The AstraZeneca Oxford vaccine, which has been manufactured and tested out in India by Serum Institute, is one case in point. We must remember that our regulator showed extraordinary foresight in allowing manufacturing and stockpiling of this vaccine pending approvals. Should the approvals come, this will be very, very valuable. And this was done at a time when we weren't sure how the trials will go. And if the trials had not gone well, this would have been a major loss. But this risk has been taken and very valuable. And this means that the moment the regulator gives approval, the vaccine is ready for rollout in the country. Serum Institute, in partnership with ICMR, has got an extraordinary capability to roll out this vaccine. Bharat Biotech and Zydus Cadila are two other companies in India which have gone into phase 3 trials. They will come soon and their vaccines will be available. And global vaccines, which you have mentioned, Pfizer and Moderna, will in due course also be available. Now, the cold chain requirements of each of these vaccines are very different. Right now, we're focusing on the ones which are likely to have approval very soon. Their cold chain requirements are not as stringent. But should other vaccines be approved which require cold chain, our industry and our research labs have full capability of handling that also.
Dr. Vijayraghavan, earlier today, Adhar Poonawalla of Serum Institute held a press conference in which he did say that 40 to 50 million of COVID-19 vaccine doses have been made. So would this mean that all of these 40 to 50 million COVID-19 vaccine doses would be for India, or can they also be exported?
Well, the capacity of our vaccine producers, particularly the one you mentioned, Serum Institute, are very large. These doses run into the hundreds of millions, and they're also being ramped up every month. Now, they will include a significant part for India. Our vaccine manufacturers are also part of COVAX and Gavi, the International Vaccine Alliance, and therefore we will also be supplying to the rest of the world. So there will be no shortage of vaccines for India, while India also supplies to the rest of the world. The government is also coordinated with neighboring countries, and there is a program in place to support neighboring countries, in particular those who will otherwise not be able to get vaccines on their own. So India is acting both responsibly to its own citizens, and as the Prime Minister has repeatedly said, it will adhere to its global responsibility.
Dr. Vijayraghavan, one of the reasons we wanted to also get you on the show today was clarify a lot of doubts that the public has. I'm sure you have also read all of these doubts that are being raised on various platforms, where citizens of this country are asking that why is it if a vaccine is good enough for the United States, for Singapore, for United Kingdom, it's not good enough for India? Is this a case of where India will only administer an Atmanirbhar COVID-19 vaccine? What do you say to such people? What is the correct situation?
These are very important questions. Every drug regulator, and ours is an important drug regulator, has a set of rules and also has a set of flexibilities. You can be assured that our regulator is not taking a view which will, on one hand, in any way compromise the safety of our citizens, and on the other hand, in any way delay access to a vaccine. Remember that countries examine data and companies give data to their regulators in a certain manner. And companies don't simultaneously make the data openly available everywhere else. Each drug regulator looks at that data in the context of their country. It's not just about safety, it's not just about efficacy, but it's about quality control and rolling out and all those mechanisms, which are also very country specific. Now, these data will be presented to each regulator and they will look at it. There will, of course, be a few days or a week's difference from one country to another, but the process ensures that when the vaccine comes, it's safe for you. It's better to be safe and get a vaccine which can roll out in our context in a precise manner than to just say that it's been approved somewhere, so let's approve here without understanding the full implications. Our regulator is fully capable of understanding all the nuances and interpretations speedily and in a manner which doesn't delay access to our citizens.
And Dr. Vijayraghavan, the dry runs that have begun in a few states, you've also started seeing chief ministers now come out and talk about the preparations in the dry runs. Can you tell us what they entail? And will each state be significantly different?
So the dry runs have been rolled out in a set of states which effectively symbolize a range of contexts for the vaccine rollout. And these 6 states are very useful in terms of testing what is happening, what's going to happen in the actual rollout. These states are Punjab, Assam, Andhra Pradesh, and Gujarat, and they come ahead of the vaccination drive. So it's aimed at testing the operations and the mechanisms for COVID-19 vaccination in each state. What will happen is that the exercise will include all the data entry into the vaccine IT platform called CoWIN. This is an online platform for monitoring vaccine delivery, and it looks at how the vaccine goes down to people and whether their entry and their data registration goes back into the system so that we know who's been vaccinated for the first time and whether and when they need to be vaccinated, for the next time. Then also this links up in the entire state in specific districts, in specific types of sessions, mock runs about how the vaccination will actually take place, how will the workers involved test it out, so that any glitches in the process are clear and documented. So then we can go on in the real time action, which will happen in a few weeks from now, do without any possible glitches. In many ways, this symbolizes, this is similar to the tests which have been done during our elections. The Election Commission also makes sure that everything is okay and checks everything before the rollout, and this is somewhat similar to that.
So the other apprehension that has now come, and this is something that's also being talked about in the global press. There's so many unanswered questions. We're in uncharted territory, aren't we? That is that will the vaccines take care of the new strain? It's in the United Kingdom saying it started in South Africa, but nevertheless, whichever way you look at it, there seems to be a new mutant and a new strain of the coronavirus. What is our stand? What is India's stand?
Well, when the virus spreads in populations across the world, that means there are a very large number of copies being replicated everywhere. When this happens, changes occur. Most changes are irrelevant to us or to the virus. Some changes will make the virus less efficient. Some changes will make it more efficient. In London, we have a strain which seems to increase transmission. I say seems because it correlates very strongly with the increased transmission seen in London. And in laboratory tests, there are molecular clues suggesting that indeed how the transmission could increase. But these tests also reveal very clearly that the domains of the virus which vaccines recognize are not affected by these changes. So the vaccine will not have a problem in being effective under these changes. Now, what we must therefore do is to embark on large-scale virus gene sequencing, which is what we have been doing in India. Our Council for Scientific and Industrial Research, our Department of Biotechnology, the Indian Council for Medical Research have all got together to have a concerted plan for sequencing so that we will not only detect these variants, the London and the South Africa variants, but any similar variants which might arise in our population. So our sequencing is will be combined with laboratory testing also and follow-up of infected people so that we are sure that if any strain arises, which is a cause for concern, we can deal with it. So this kind of preemptive work will take care of any possibilities which may happen, and we are fully on guard on that.
Have we so far been able to arrive at any data, any figures for the number of priority people that will need vaccine in the first phase?
Yes, we have done that. There's a committee called NEGVAC, which is headed by Dr. Vinod Paul and the Health Secretary, Mr. Rajesh Bhushan. They've identified healthcare workers as a priority. That number is about 1 crore. These are health providers and workers with government and private healthcare context. Frontline workers, about 2 crores. Priority groups, which are people above 50 years of age, that's about 26 crores. And priority groups of people under 50 with associated comorbidities. So that's about 30 crores, 300 million people, which is enormous by any standards. And this will take care of the first wave starting very soon. We must keep in mind that vaccines initially will be available in limited doses. Going forward to the second quarter of the next year, we will have large numbers of doses available, and we will have continued vaccination after that. So the phased program will have to deal with lower numbers of doses available initially, but very soon doses will be available, and that's why we need prioritization.
Okay, with that, Dr. Vijayraghavan, I'd like to thank you for taking the time out for joining us here on this edition of the India Development Debate. That is the Dr. Vijayraghavan giving us a lot of clarity on the way forward. Some good news coming in, whether it's going to happen before 1st January or a few days afterwards. The fact is we will be beginning 2021 with hope and optimism when it comes to the vaccine.